Well, hello there, Nurse Mo here, and in this quick training, I'm going to share with you how to use a report sheet. So you've heard people talking about report sheets. You might have questions about what a report sheet is, so that's what we're going to be going through here. So a report sheet is essentially the reference sheet that you use to keep track of your patient's most important information. And we call it a report sheet because you use this at the start of the shift when you get report from the offgoing nurse, and then you'll use it again at the end of your shift to give report. You may also hear it called a brain sheet. You might hear a nurse say, "I can't find my brain." That doesn't mean they've lost their actual brain. It means they can't find their brain sheet where they've written down all their notes about their patient. So report sheet and brain sheet are interchangeable terms. So the components of a report sheet, of a good report sheet, are that it is an SBAR format. And we'll talk a little bit more about what that is in just a moment. And you also want to have sections where it is organized by body systems, and checkboxes make it really fast and easy to notate things that happen very frequently for the patients on your unit, or assessment findings that are really common for patients on your unit, because end of shift report is really fast. You don't have a ton of time to get report from the offgoing nurse, and they're going to talk fast, and you need to get the information down as quickly as you possibly can. So let's look at that SBAR format. In the situation section of the report sheet, I like to have things like the patient's name, their age, their gender, their code status, if they're on any isolation, and what was their chief complaint? Why did they show up and seek medical care in the first place? And then beyond that, listing their primary diagnosis and their admit date. I also like to keep track of any big procedures they've had for this admission, the doctors that are on their case so that I know who to call if I have a problem or a question, and then any significant highlights. In this case, the patient is 85 years old, male, full code, not on any isolation. Their chief complaint, and the reason they showed up to the hospital, was they'd been tired and had dark stool for about 3 days. They were diagnosed with a GI bleed and admitted on September 4th. Since then, they've had an EGD and a colonoscopy. Their main doctor is Dr. Driscoll, and a big highlight was that these scopes were done on 9/5. I would also include here if the patient was in the ICU for part of their stay, on a ventilator, on any really significant medications and things like that. In the next section is B for background, and this is where I like to include the patient's past medical history. We don't have to go into every single problem they've ever had. Let's try to keep it relevant to why they're here now and anything that's going to impact our care. In the clinical setting, it's a core measure to keep track of flu vaccines and pneumonia vaccines, so I'm going to have a little space for those. I also want to know about their allergies and any psychosocial stuff that's really important. So in this example, the patient has rheumatoid arthritis as well as osteoarthritis in their right knee, and they take a fair amount of ibuprofen every 6 hours. They have coronary artery disease, Parkinson's, mild dementia, and chronic kidney disease stage 2. They're current with both their flu and pneumonia vaccines. They don't have any known drug allergies, and they live at an assisted living facility with family nearby. In the assessment section of your SBAR report sheet or brain sheet, this is where you basically have your head to toe assessment of the patient and any other key things. So as you can see here, the patient's neurostatus, he's oriented to person, place, and time. That fourth, if I had circled the 4, that would mean he's oriented to person, place, time, and situation, basically understanding why he's in the hospital. So he's mildly confused. As for his cardiac system, his heart rate is in the 70s when he's awake, but it's in the 50s when he's asleep. By knowing that that's normal for him, I'm not going to be really concerned about it when it happens later on my shift if he falls asleep. And then I like to keep track of what his baseline blood pressure is. His respiratory status, he's 96% on 2 liters nasal cannula. And then we get into the GI issues, the diet, the genitourinary issues. There's also space to keep track of any information about their vascular status if they do have any vascular abnormalities, anything related to hematology and infection as well. And then also you see a space there for DVT. I want to keep track of how we're preventing DVT in this patient. This patient has their SCUDS. Some patients will also have a prescription or an order for something like enoxaparin or heparin for their DVT prevention. Following that, we've got space for his musculoskeletal status. I've written down here that he has bathroom privileges and he uses a walker with standby assistance. I want to make sure I keep track of his skin. It's clear, good job. Any dressings and drains, IV sites, and then GTT stands for drip. So any drips that he's on or infusions. And in this case, the patient is on D5 half NS with 20 of K at 75 mils per hour. That means he's on a solution of 5% dextrose in 0.45% sodium chloride with 20 milliequivalents of potassium. I want to keep track of his pain. He doesn't have any pain right now. Good job. And any pertinent labs, such as his potassium level, his hemoglobin, his hematocrit, and his platelets, for example. And then the final section is R for recommendation. This is basically the recommendation or the plan for how we're going to progress the patient's plan of care. So in this case, with the patient who's there for a GI bleed, the plan is we're monitoring for bleeding. We want to increase his activity and maybe he will get discharged and go home tomorrow. And then for our to-do section, this would be if the nurse is telling you in report that, for example, she replaced the patient's potassium at a certain time. You know you need to go back and check that potassium level at a specific time. So I'm going to jot that down on my to-do list right now so I don't forget. So what does this look like? Let's take a quick look. So when you start your shift, you'll get all the details from the nurse giving you a report, and then some you'll need to get from the chart. Maybe you want to go in and look at his labs when you do your start of shift routine and make your plan for the day. And then you're going to add to this as you assess your patient and intervene throughout your shift. So you can see here that I've updated it in red. So a different color is really helpful to use for your changes throughout the day so that you can easily see what's happened throughout your shift. And then here's a little close-up of what that looks like. So as you can see, he became lethargic throughout the shift. His heart rate went up. His blood pressure went down. His oxygen saturation level decreased, but he was on more oxygen. He had frank blood in his stool, which means bright red blood indicating an active bleed. He is now NPO. His pulses are weak. He got 2 units of packed red blood cells, and on it goes. So clearly this patient had continued bleeding throughout the shift and decompensated a bit. So you'll use this updated sheet to give a report to the next nurse at the end of your shift. And that's how you use a report sheet, or as we call it, a brain sheet.